What is the FEV1 FVC ratio in asthma? Imagine trying to blow out a candle with a quick, forceful breath. Now, think about how your lungs perform that task. The FEV1 FVC ratio helps doctors understand how well your lungs are working. This ratio is a key part of lung function tests used to diagnose asthma. It compares the amount of air you can forcibly exhale in 1 second to the total air you can exhale after taking a deep breath. The first number, called FEV1, is how much air you blow out in the first second. The second number, FVC, is the total amount of air you can exhale after a full breath. In healthy adults, this ratio is usually between 75% and 85%. That means most of the air you breathe out in the first second is a big chunk of what you can exhale in total. But in asthma, this ratio tends to be lower. That's because asthma causes your airways to narrow and become inflamed, making it harder to push air out quickly. When your airways are blocked, your FEV1 drops more than your FVC, leading to a reduced ratio. A common cutoff point for airflow obstruction is a ratio below 70%. If your ratio is less than this, it suggests your airways are obstructed. The lower the ratio, the more severe the airflow problem. For example, if your FEV1 FVC ratio is just a little below normal, it might be mild asthma. If it's much lower, it could mean more serious airway narrowing. Doctors also look at how much your FEV1 improves after using a medication called a bronchodilator. If your FEV1 and FEV1 FVC ratio gets significantly better after using this medicine, it supports an asthma diagnosis. This is because asthma is often reversible, meaning the airway narrowing can improve with treatment. Sometimes, between asthma attacks, your FEV1 FVC ratio might look normal. But if your symptoms come and go, and your ratio improves after medication, it still points to asthma. This test is very helpful for confirming the diagnosis, understanding how severe it is, and seeing how well your treatment is working. In simple terms, the FEV1 FVC ratio in asthma is usually lower than normal because of airway narrowing. But with treatment, this ratio can often improve, showing that the airway obstruction is reversible. That's why measuring this ratio with spirometry is so important in understanding and managing asthma.